Welcome to Senior Moment Successful Aging. I'm your host, Mary Beals-Lutka. I'm the Director for the Area Agency on Aging at NACOG. You can reach our Area Agency on Aging toll-free if you have any questions or information that you need about aging and disability services. Our toll-free number is 877-521-3500. This show is co-sponsored and produced by Yavapai College Division of Lifelong Learning, and our producer, Jody Bueller, who does all the work except for talk, and I really appreciate everything she does. She'd love to hear from you. Maybe you have a question about today's show. Maybe you have ideas about something you'd like to hear about in the future. Please give her a call. Her number is 717-7607. And again, thank you, Jody, for everything you do. Today, I'd like to introduce you. One of my staff is here with us. One of my management team, Program Manager for Senior Services, Jana Szoke. Hi, Jana.
Hi, Mary. Thank you for having me.
Thank you for joining me on Senior Moment Successful Aging. So I want to start out a little bit. First of all, what is your position at NACOG Area Agency on Aging? And then we'll backtrack a little bit about where you came from.
Okay. Well, I am the Senior Services Program Manager for Yavapai, Coconino, Navajo, and Apache counties, which is our region, for case management, central intake, information and referral, and the family caregiver program.
Doesn't sound like you have much to do.
Not much,
Not
no.
much at all. And I know you have a couple of offices.
We have offices in all 4 counties. We have main offices in Flagstaff. We have Aging and Disability Resource Centers in Lakeside. We have a Prescott Valley office, which is a beautiful office here. We have satellite offices in Winslow, Snowflake, Show Low. We are in Apache County as well. So we really have lots of coverage throughout the areas.
And you're like me, you live out of your car.
I live out of my car in a suitcase, yes.
Yeah. With extra things just in case.
I'm getting better at that.
I know. It's like when you travel, you have to be, what did you say? I'm the consummate traveler because I have all these little extra things just in case something comes up and I got to stay all night again. Well, one of the things we're going to concentrate today on today's show is, what is case management? What do we have to offer? But first of all, I want to talk a little bit about where did you come from and what is your background?
Where did I come from? I was born in Newport Beach, California. I grew up in Southern California. We moved to Arizona when I was 17.
Aye.
Yes, I graduated high school in Pine Top from Blue Ridge High School. What a culture shock. It was just a little while ago. And my background is in business. I have a degree in business management and elementary education as well. I've taught school on the Indian Reservation for 5 years. It was a joyful, rich cultural experience, and I've worked in escrow. I've been an assistant escrow officer, and so I'm pleased now to work for you and aging.
And I know you started as a case manager.
Yes.
And then, after you got your master's degree, et cetera, you were the perfect fit for us to be a program manager. So could you describe what does case management mean? Because I think there's a misconception out there. What do we have to offer folks, and what does case management give to those folks that need assistance, and all the way to information referral? Where do you go?
Case management is a comprehensive, collaborative support system for each client that calls. Every client that calls is handled in a unique situation based on the client's needs. We really listen at the first step, which is the central intake, via our toll-free number 877-521-3500. We have AIRS certified specialists that answer the phone. They do an intake over the phone. They ask specific questions. Anyone can do a referral. A neighbor that's concerned, a caregiver, a child of a parent that is aging. A client can make a referral for themselves as well if they're needing some assistance. And so that's where it begins, at our central intake department. And based on the intake, then the referral is automatically automated. We're so proud of going green.
Yes. That's been a process, hasn't it?
Yes, it's been quite a process, but we're very excited to have that in place, and it's then sent out from central intake located in Flagstaff to the case management supervisors that are located in our 4 counties. And so from that point, it's then routed to the case manager, and it's usually done within a 24-hour period. And that's something else that's very nice to have readily available for the clients, so they're hearing back in a short period of time.
And I know one of the things that I hear when I'm out and about is, oh, why call? I hear that they're out of money. That seems to be kind of something that you hear a lot of. And so what is your answer to that?
Well, that's a great question. Thank you for asking it. It gives me an opportunity to speak to that because I hear that as well at community meetings and so on. Because we are NACOG, we are also the Area Agency on Aging, which is a division of NACOG. NACOG is a very large umbrella that has numerous departments under that umbrella: weatherization, Head Start, community services. But the Area Agency on Aging is the department we work for, and we do have funding. While we do triage our client caseloads to make sure that the most needy clients are receiving the services, they're not endless. They are a finite resource, and so as case managers, we triage our caseloads. We really reassess, reevaluate. We're continually looking at our caseloads to make sure that the clients with the least amount of supports, the lowest financial, the lowest Social Security, for example, those are the clients that get the services first.
And really, we're a stopgap. You've got your healthy, independent senior, and you've got someone who's on the Medicaid or access system. We're in the middle.
That's right.
And I think it's important to note that there is no means testing per se. So your assessment is not based on how much money you have or don't have. And I think that's important. And obviously, information referrals for everyone.
Absolutely.
Anyone who has questions about aging or disability issues and services need to call that toll-free number. It doesn't matter how much money you have or don't have. That service is there for you.
And it doesn't matter if you're a senior.
Correct.
Anyone can call in. We have a resource house we're building. It's a database of resources. It extends to all counties. Yeah. We're keeping it current. We're gathering data all the time for the purpose of disseminating that information to every nook and cranny in every community and really getting the word out. So you don't have to be a senior to call the toll-free number. Anyone can call the toll-free number and get that information and referral for all 4 counties. So we encourage those calls. Yeah. We are very pleased to help in any way we can.
And I really think it's like, okay, when would I call? When would I call the Area Agency on Aging? What are some of the typical questions that you get through your central intake unit?
Some of the typical questions we get are regarding requests for services, and we have services available: attendant care, which is a combination of housekeeping and personal care. We have respite, which is a wonderful break for both the caregiver and the client. We have in-home respite. We have adult daycare services offered in some of our counties as well. We have Meals on Wheels services. We have an adaptive devices program, and we also have our case management, which does make referrals to other agencies. Really, they're the finger on the pulse. Yeah. They are the ones that those case managers are vitally important to all of our programs. As you say, they're our gatekeeper.
They're the gatekeepers.
They are the gatekeeper.
Absolutely.
And so they're in constant communication with the clients. They're in the clients' homes. We have set up 3-month schedules with our client caseloads, which typically run between 80 and 120. It's a little lower in some areas and almost higher in others. Yavapai County is very busy at this time, and so we're making the necessary accommodations to make sure that no clients go without service or go without the case management piece. And as you said earlier, we are a stopgap. We are intended to be a temporary 3-month service, and from that point on, with the intent being that the client gets better, stronger, those family supports come together and really support that client so that they are able to remain in their home, which is our ultimate goal.
Yeah.
Or we make referrals to Arizona Long-Term Care, some cases hospice. We really follow the needs of the client. The client dictates all of our services.
I think that's important too. It's not that you're going to have a case manager come into your home and say, okay, you need this, this, and this, and check a box.
That's
right. And I think it's important to note that, it's a holistic assessment that includes the caregiver.
Exactly. The caregiver is such an integral part of the assessment process, of the initial home visit, and then determining the need of the services and how many services that client will receive, and how many units, based on availability of course, but how many units that client will get per month. And it's a holistic assessment. We, as case managers, and I say as case managers because I was, yes, I'll always be a case manager. We look at the entire client. We assess the family. We bring in those supports and services to really address the needs of the family and the client, but really looking at the big picture.
And I think, I'm just going to throw a little, plug in, because in these economic times, I think it's really important to note that these services really save the tax dollars, because we can, for a small amount of money, go in, do that assessment, make those referrals, bring together those services that need to be brought together, including the services from informal caregivers. Support those informal caregivers rather than having them going on that more expensive Medicaid system, because that is expensive.
Absolutely. And it is, aside from the huge cost savings to CMS and our state systems. Center for Medicare and Medicaid. Sorry. We have lots of acronyms.
Yes, we do.
Use.
We got to be careful.
Yes. Aside from that, the clients are happier. They remain in their home. We're respecting the dignity of their own environment with their families and, their own things, and the quality of life we're addressing as well by providing those in-home supports and services. And that's supported by facts and data.
Oh, yes, we have a lot of data showing that it's really important for just a small amount of support to keep folks from going onto that system. And we've actually got data that shows that on an average, and this comes from the state of Arizona, we can avoid the long-term care system up to 3 years.
Yes.
So we are able to keep folks in their home ultimately almost 3 years longer than might otherwise be possible without something as simple as a home-delivered meal. And I think a lot of folks don't realize the Area Agency on Aging is very much behind the Meals on Wheels. They have to be case managed.
Yes.
But then I also have to say, at the local level, the senior centers rely very heavily on local dollars and local donations. We certainly are not their only funder.
That's right, and the volunteers as well.
Oh, yeah.
The volunteers are so wonderful, and our clients look forward to seeing them every day. Every time the meal comes, you can see the clients waiting by the front door for that visit.
Yeah.
So the socialization and the isolation, those are some of the issues. It's not just about nutrition anymore. It's about accessibility to the human race, and really keeping that door open.
And knowing that, we all need to be touched.
Yes.
We all need to be involved and have a conversation. And that isolation creates a myriad of health conditions.
Absolutely.
And, I think that would be a good time. This would be a good time to plug also that you could call the toll-free number for volunteer opportunities.
Absolutely.
And we have a lot of volunteer opportunities at the Area Agency.
Yes, we do. We rely so much on our volunteers, and we have so many wonderful volunteers and so many different programs that volunteers can apply for and really come alongside us and help support our senior communities. We rely very heavily on them.
And, I think it's important to note that there's so many different things you can volunteer for, so it depends on your what you want to do and how much you want to give.
Exactly.
An hour a week or a day a week. We have a volunteer that comes in and supports the case managers in Prescott Valley. I don't know what we'd do without her.
I don't either.
I mean, she really helps process. She helps set up phone calls. She helps with the paperwork. She helps with the filing, etc., which is mostly done on computer, as you said. And then we have volunteers that help with the family caregiver program. And the family caregiver program, I think, I'd like you to address that briefly, and then I'm going to move into care transitions. So, how important it is to support those caregivers and what we can offer them.
Absolutely. The Family Caregiver Program is being recognized nationally. Those unpaid informal caregivers are really the backbone of America right now. As we see America graying, it's vitally important that they are recognized and supported. And NACOG Area Agency on Aging is one of those. They're cheerleaders, basically. We really don't know what we would do without the family caregivers. So by way of support groups and coalitions, once again, our toll-free central intake number with our resources that we have available. If anyone is willing to step up and say, I would love to support the Family Caregiver Program, we would be very interested in talking to them about being a liaison, a support, in recognizing and also providing the services that the caregivers need by way of respite.
And we also do the training.
We do the training.
Training for them, and that's important.
We have like you said, one size doesn't fit all. With our program, we've got many different opportunities as well as the Family Caregiver Program. So please give us a call if you're interested and let us know.
Or if you're a caregiver and you're like, I'm lost, I don't know what I'm doing. Because usually you don't sign up to be a family caregiver.
That's right.
A loved one becomes ill, and then you're all of a sudden dealing with tubes and needles and all these kinds of things, and where do you go? And so I really encourage our viewers to call the Area Agency on Aging if you're a caregiver.
Or if you suspect you're a caregiver.
Yeah, and I love that, because people don't really, they'll say, no, I'm the brother, or no, I'm the wife.
I just do this. I just give the baths. I just give the food.
Guess what?
You're a caregiver.
Yeah, so you need help. And I know when I got thrown into a caregiver role, it was like, well, for me it was a lot easier. I'm a former nurse.
Yes.
Well, that's not the same thing for everybody. So, please call us for information, referral, and support and training. And we do plan on this spring having activities of daily living training in Prescott Valley area.
Absolutely.
So, if you're interested, give the Area Agency on Aging a call. One of the areas that case management's really moving into is really new and very, very much needed. And I'd like you to address that, and that's care transitions.
Absolutely. We are very excited to be taking part in this statewide initiative, a federal initiative, to reduce hospital readmissions within the first 30 days of discharge among Medicare beneficiaries. A lot of the situations that our seniors will find themselves in when they're discharged from the hospital are medications that they are taking upon discharge that they have multiples of at their home, so they are continuing to take their medications they were discharged with, their medications that might have been prescribed through their primary care physician, cardiologist. I mean, so many of our seniors have multiple specialties that they see, and so with each specialty they have separate prescriptions, but when they are discharged from the hospital, they need the support, first of all, for that medication reconciliation piece. They need a personal health record. These are all supports that NACOG Area Agency on Aging provides. We are in the patient's home within the first 24 hours of discharge. We work very closely with the discharging agent. It could be a hospital, it could be the home health department, could be a SNF, a skilled nursing facility. We accept and welcome all discharges and all care transitions clients from every setting. The intent is to cross the continuum of care, provide that in-home support that those patients need. And I don't call them clients. They are clients, but they're also patients. Yeah. And so they really do need that hands-on component in their home.
That's one of the things that the federal government has really taken a lead on, because there is a huge cost to our society and to our taxpayers and to the system for folks that are readmitted for the same thing because they have no support system when they get out of the hospital. And we had some really scary calls throughout our counties. One of them was a call, a neighbor called someone else and someone else called us, and this person was discharged from the hospital, and the hospital did everything, on the checklist, but this person was discharged with an oxygen concentrator and didn't have electricity in his home. And so he was found in his car with a extension cord to his neighbor.
Yes.
Whoa, wait, that's something really wrong with that picture. So those are some of the very important reasons why we've gotten involved with care transitions, because we want to be able to offer that case management to that Medicare. And we do target, obviously, the most needy.
Yes.
If you've got a support system, you've got a great wife at home, you've got, your husband at home, or you've got a daughter nearby, or a neighbor that's going to help coordinate that for you, great. We want you to utilize that system because we don't obviously have infinite resources.
Absolutely. But we do focus on the intense 30 days of case management, and that also does include follow-up phone calls to the physician, assisting in the prescription refills. We provide medication reconciliation, I mentioned earlier, the personal health record. We help the patient review their discharge plans. We shore up any caregiving supports they may have. We've contacted children that live in Phoenix that didn't even know mom or dad was in the hospital. We have contacted neighbors and started home delivered meals, and we've also found that a large majority of the care transitions clients we've received have become NACOG clients
down the road
because they are in that critical situation, and they do, while we don't means test,
right, which is the money thing,
we don't means test, but we do look at each client individually, and we assist them in gathering all the independent supports that they have available to them. But beyond that, we are available to step in and help them transition safely back to their homes, especially within the first 30 days, which is the window of time where they're most likely to be readmitted.
And it's just crucial. And I'm really excited about it because you are the lead in this program, and I know that we're working closely with several hospitals, and now we're expanding into Yavapai County. And I think, if you're listening and you know somebody who's being discharged, give our toll-free number a call.
Please.
Doesn't hurt.
Please.
Find out what's available and help these folks during their transition. I know that, as an old nurse, years ago, we kept people in the hospital longer. And now, when you're discharged, you're still pretty frail.
Yes.
I myself have been discharged from a hospital several times in the last couple of years, and I really wasn't ready to go home, per se, by myself.
That's right.
I needed assistance. I needed help. I had a hard time getting up after one of my surgeries just to go to the bathroom.
Yes.
So don't think, I don't want to ask for help. I can do it by myself. I couldn't do it by myself. So we need to make sure, and that case manager can help you bring all those pieces together, and like you said, maybe call someone that maybe didn't even know and you didn't want to ask, because I think I'm that way. I'm a very independent person, a very independent woman, and it's hard for me to say I need help.
Yes.
I need help.
And it is. It's very difficult for a lot of our seniors to say, I came from this generation when it was pull yourself up by your bootstraps and take care of everything, and now they're at a place where they might need some assistance. And so the case managers are so important, engaging based on what the clients say. We want to respect the wishes of the client first and foremost, but we also need to provide those supports to keep them in their homes, to keep them safe longer.
And I think it's important because for the information and referral line, there's a lot of little things that are available out there that people just don't know about.
That's right.
And so that's what their job is. And she mentioned earlier AIRS certified, and really that's a national certification for information and referral persons. And we're very proud that your team is all certified.
Yes.
So they have to do constant training They have to take some very detailed testing. So they're really skilled in listening and getting through a lot of information and trying to get to the crux of what this person needs. Sometimes you call and you don't even know what you need.
That's right.
I don't know what I need, but here's my situation. They're trained to help you navigate that little road. And I think, you mentioned earlier, case managers are gatekeepers, but they're also navigators.
Yes, absolutely.
Yeah.
The case manager stays with the client.
Yeah.
They are our clients. They become almost one of our family, to the point that it's not every 3 months. It's so much more than that the case manager is contacting the client and making that contact and making sure that the client is safe and touching base with our providers and making sure that how they're feeling, that they're doing well, and really adjusting the services based on the needs of the clients and listening to what the client has to say.
So, thank you very much for coming on today.
Thank you for having me.
And explaining what case management and what information referral is for the Area Agency on Aging. So hopefully more people feel free to pick up that phone. You can also go online to NACOG.org/aging and look up our services, and there's a little button you can push and say contact us.
Yes.
And it'll go to central intake, and you can also email it. It says AAA director, but I have to confess it doesn't go to me. It goes to my staff, but believe me, if it needs to go to me, they'll let me know. And and I just want to publicly thank you, because you really brought the case management piece together and making it just what our goal is, that comprehensive coordinated system that we really need to have.
You're a wonderful visionary leader.
Thank you.
And so it's easy to be out there and developing those programs. So thank you.
And thank you for joining us today and learning a little bit more about what the Area Agency on Aging does and what we can do for you or for your loved one or for your neighbors. And again, this is Senior Moment, successful aging, because that's what it's all about, and I think it's not just successful aging, it's successful living. So thank you again for joining us, and we'll see you next time.